In lieu of devotional, we'll have a moment of silence. Thank you. Are there any announcements? Senator from Essex.
Mr. President, I move that the Committee of Institutions be relieved of S-85, an act relating to allowing probation and parole officers to carry firearms while on duty, and that the bill be committed to the Committee on Judiciary.
Thank you.
Thank you, Mr. President.
Senator from Essex has moved that the Committee on Institutions be relieved of S-85, an act relating to allowing probation and parole officers to carry firearms while on duty, and that the bill be committed to the Committee on Judiciary. Are you ready for that question? If so, all those in favor signify by saying aye. Aye. All those opposed, nay. The ayes have it, and you have recommitted S-85 to the Committee on Judiciary. Any further announcements? If not, we have two Rule 31 referrals. That's 301. That's 301, will be committed to the Committee on Finance.
And S-220 will go to the Committee on Appropriations. We have one gubernatorial appointment for referral, and that is Superior Court Judge Kate Gallagher to the Judiciary Committee. And that will be moved to the Judiciary Committee for further consideration. We have a list of House bills for reference. H-780, an act relating to judicial nominations and appointments. Please listen to the second reading of that bill. First reading of that bill.
H-780, an act relating to judicial nominations and appointments.
Having heard the first reading of the bill, H-780 will be committed to the Committee on Judiciary. We have H-847. Please listen to the first reading of that bill.
H-847, an act relating to peer support provider and recovery support specialist certification.
Now, having heard the first reading of the bill, H-847 will be committed to the Committee on Health and Welfare. That brings us to the orders of the day. We have up for action H-469, an act relating to remote and electronic processes for executing an advance directive. That is a third reading. Are there any amendments before third reading? Seeing none, please listen to the third reading of the bill.
H-469, an act relating to remote and electronic processes for executing an advance directive.
Having heard the third reading of H-469, the question now is, shall the bill pass? Are you ready for that question? If so, all those signify by saying aye.
Aye.
If not, signify by saying nay. The ayes have it, and you have passed H-469. We now have up for second reading S-187, an act relating to student application of sunscreen and car seat safety. For the report on the Committee of Health and Welfare, I look to the Senator from Rutland, Senator Weeks.
Thank you, Mr. President. On this,
Senator, one moment. My mistake. Please listen to the second reading of the bill.
S-187, an act relating to student application of sunscreen and car seat safety.
With that said, I would turn to the Senator from Rutland, Senator Weeks.
thank you, Mr. President. On this cold and wintry day, I want to bring you back outdoors to the summer sun and thoughts of sunscreen. On behalf of the Health and Welfare Committee, I would like to lead you through a one-page S-187 an act relating to student possession and application of sunscreen, introduced by the Senator from Chittenden North and the Chair of Health and Welfare via language offered by the American Society of Dermatology Surgery Association and the Vermont State School Nurses Association. This is a single issue, straightforward, not complicated bill. The original draft included a section related to child seat belts, but this was removed and shared with the Transportation Committee. So first, the problem. The problem is that Vermont has the second highest skin cancer rate in the United States. Due to active ingredients, sunscreen is an FDA-regulated over-the-counter medication. Currently in Vermont, all sunscreen brought to schools for students must be physician prescribed, carried into the school by an adult, stored by the school nurse, with each application being documented alongside other student prescriptions. So you can see this is logistically complicated and potentially limits access. So the solution. The solution is to add one new provision to Section 1, Title 16, VSA Chapter 31. Section 1, sunscreen will join the list of over-the-counter medications such as Tylenol, Motrin, Benadryl, Tums, and others, with parent or guardian permission, reviewed annually, would permit students to possess and self-administer sunscreen and allow school personnel to assist in applying sunscreen only if they have parent or guardian authorization. Section 2, effective date of July 1, 2024. This bill follows the example of 27 other states to eliminate barriers that prevent students from taking proactive measures against sunburn. The committee received testimony with 100% support from Katie McLean, Office of Legislative Counsel, Carlos Gutierrez, Vice President of State and Local Government Affairs, working for Consumer Healthcare Products Association based out of DC. Jamie Kirch, an RN out of Dartmouth-Hitchcock, Department of Dermatology. Clayton Wetzel, the past president of the Vermont State School Nurses Association. Elisa Stahlberg, maternal and child health director at the Department of Health. Brendan Atwood, the public health policy advisor from the Department of Health. Sue Kozlowski, executive director, Vermont School Board Association, and Colin Robinson, political director, Vermont NEA. The committee vote was 5-0-0. We welcome the full chamber to join the Health and Welfare Committee in approving S-187. Thank you, Mr. President.
Thank you, Senator. The question is, shall the Senate amend the bill as recommended by the committee on Senator from Chittenden Central?
May I inquire of the presenter of the bill?
The presenter will be interrogated.
Thank you, Mr. President. I see in section 1, subsection B, that school personnel shall not be required to assist students in applying sunscreen and are not responsible, but is it allowable for them to assist students?
Mr. President, yes, it's allowable, but only with parent or guardian permission.
Thank you, Mr. President.
Thank you. The question again is, shall the Senate amend the bill? Senator from Bennett.
Thank you, Mr. President. I appreciate a couple of emails and questions I received about whether or not Senate Education wants to take a look at this bill. We definitely don't. It's terrific that a majority of Senate Education is on Senate Health and Welfare, and we certainly appreciate the chair of Senate Health and Welfare taking up this issue. Thank you, Mr. President.
Very smooth inter-committee work there. The question again, shall the Senate amend the bill as recommended by the Committee on Health and Welfare? Are you ready for that question? If so, all those in favor signify by saying aye.
Aye.
All those opposed, nay. The ayes have it, and you have amended the bill as recommended by the Committee on Health and Welfare. The question now is, shall the bill be read the third time? Are you ready for that question? If so, all those in favor signify by saying aye.
Aye.
All those opposed, nay. and you have asked that the bill be read the third time. We have up for second reading now, S 302. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the bill be amended as appears at page 462 of today's calendar. And that when so amended, the bill ought to pass. I'd like to recognize Senator from Rutland. Oh, please listen to the second reading of the bill.
S 302, an act relating to public health outreach programs regarding dementia risk.
Thank you. I would like to recognize the senator from Rutland, Senator Williams.
Thank you, Mr. President. Bill S 302 can be found on page 462 of the Senate calendar. Committee on Health and Welfare, to which referred section Bill S 302, entitled an act relating to public health outreach programs regarding dementia risk, respectful reports that be considered the same and recommended that the bill be amended as striking all after the enacting clause and inserting in lieu thereof the following. Section 1, 33 DSA, section 6221 is amended as read. Section 6221, public education resources. Department of Health and Disabilities, Aging and Independent Living, Dale, shall jointly develop and maintain easily accessible electronic, print, and in-person public education materials and programs on Alzheimer's disease and related disorders that shall serve as resource for patients, families, caregivers, and healthcare providers. The department shall include information about the state plan on aging, as well as resources and programs for prevention, care, and support for individuals, families, and communities. Section B1, the subsection B, the Department of Health, Mental Health, and Disabilities and Aging and Independent Living, in consultation with the Commission on Alzheimer's Disease and related disorders and other relevant work groups and community organizations, shall, as part of existing and relevant public health outreach programs, educate healthcare providers regarding the value of early detection and timely diagnosis of Alzheimer's disease and other types of dementia. 2, validated assessment tools for the detection and diagnosis of Alzheimer's disease, youngest onset Alzheimer's disease, and other types of dementia. 3, the benefits of Medicare annual welfare visit or other annual physical for an adult 65 years of age or older to screen for Alzheimer's disease and other types of dementia. 4, the significance of recognizing the family care partner as part of healthcare team. 5, the Medicare care planning billing code for individuals with Alzheimer's disease and other types of dementia. And 6, the necessity of ensuring that patients have access to language access services when appropriate. And subsection B, increased public understanding and awareness of 1, the early warning signs of Alzheimer's disease and other types of dementia. 2, the benefits of early detection and timely diagnosis of Alzheimer's disease and other types of dementia. Subsection 2, in their public health and outreach programs and any programming and information developed for providers pertaining to Alzheimer's disease and other types of dementia, the department shall provide uniform, consistent guidance in non-clinical terms with an emphasis on cultural competence as defined in 18 VSA section 251 and health literacy, specifically targeting populations at higher risk for developing dementia. This effective date, this act shall be effective 1 July 2024. The Committee on Health and Welfare voted out S 302-500. And we heard testimony from Brendan Atwood, Public Health Policy Advisor, Department of Health, John Bouton, family member, Alzheimer's Association, Vermont chapter. Senator Randy Brock, sponsor, Franklin County. Mary Claire Carroll, family member, Alzheimer's Association and Vermont chapter. Jay Green, racial equity policy and research analyst, Office of Racial Equity. Katie McGlynn, legislative counsel, Office of Legislative Counsel. Meg Pulte, policy director, Alzheimer's Association, Vermont. Rebecca Silvernagle, principal assistant, Department of Disabilities, Aging and Living, Independent Living. And Christelle Tonoki, student at the University of Vermont. We recommend that this body support the Health and Welfare's passage.
Thank you,
Thank you,
Senator.
Mr. President.
The question is, shall the Senate amend the bill as recommended by the Committee on Health and Welfare? Are you ready for that question? If so, all those in favor signify by saying aye.
Aye.
All those opposed, nay. The ayes have it, and you have passed 302, S302 for third reading. Oh, my mistake. The question now is, shall the bill be read the third time? Are you ready for that question? If so, all those in favor signify by saying aye.
Aye.
All those opposed, nay. The ayes have it, and you have ordered third reading of S302. I believe we will pass over JRS 41 today, given the absence of the presenter. And with that said, that takes us out of the orders of the day. At this time, I would look to the senator from Windsor for a motion.
Thank you, Mr. President. I would move that the Senate stand in adjournment until Tuesday morning, March 12th at 9:30 a.m.
And that motion is predicated
Right, that,
pending announcements.
right, pending announcements that we adjourn until Tuesday, March 12th at 9:30. Thank you.
Senator from Windsor has moved that the Senate stand in adjournment until Tuesday, March 12th at 9:30 a.m. Are there any announcements? Senator from Benton.
Thank you, Mr. President. Senate Education will meet at 1 o'clock.
Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 1 o'clock.
Senator from Addison.
Thank you, Mr. President. Senate Government Operations will meet at 1 o'clock.
Senator from Essex.
Thank you, Mr. President. Senate institutions will meet at 1 o'clock.
Senator from Windsor.
Thank you, Mr. President. I hope that every senator has a restoring week. We all need it. You've worked hard. Thank you for all your work. And I hope you have a splendid time re-embedded in your communities.
Thank you. I just wanted to say on a personal note, I was gratified to see a very close vote followed by an immediate hug and joint handshake.
Yep.
I thought that was the essence of sportsmanship and a model for the nation.
Yeah.
With that said, Senator from Windsor has moved that the Senate stand in adjournment until 9:30 a.m. Tuesday, March 12th. Are you ready for that question? All those in favor signify by saying aye.
Aye.
All those opposed, nay.
No.
I believe the ayes have it, and we will stand in adjournment until 9:30 a.m. Tuesday, March 12th.